My team, our goal is to solve problems with data every day. And the problem that we were solving with anesthesia coverage started as we just didn't have enough providers to meet the needs that we had in our current system. And so we started from a forecasting perspective, trying to understand the anesthesia locations that we could support, and then what did our block schedule plan to support. And we started to basically align those as best as we possibly could, and then we moved forward with a staffing plan that aligned with that. That then morphed into more of a predictive model looking at ALs or anesthesia locations out into the future. One of the problems that we ran into is that our schedule doesn't solidify until about, I'd say, 3 to 4 days out. That was the big problem. And so we had to try and understand, I always tell my team, we control what we can control, and then we create enough access for the rest to flow in, right? And so we buffered that with demand planning and that kind of thing, using all Epic reporting and Tableau dashboards. That's what our institution uses. But we did that, and then we created a plan that was based on the block schedule, but had some play in it for blocks that weren't going to fill, or blocks that were going to overfill, or that kind of thing. We honed it down. We got much better at it as we progressed through the project, and today we're in a much more mature state now, where we're sort of right on the button of aligning resources to ALs. But I would say the exact same thing that Mark said, is that we plan to the overage, not the underage, right? We always want to have a few providers more than we potentially need, so that we're not restricting access or restricting care.